Good day, everyone. We are from the University of St. La Salva College, BSN 3D Group 2B, and together with me is Justin May Madera. We are here to present to you our research topic, which is mental health status of nurses during COVID-19 pandemic. For the brief background, COVID-19 has impacted the life and health of several people all over the world. This swamps a number of countries' healthcare systems and also impacts several healthcare providers such as staff nurses fighting on the front lines to save the human lives who are affected by the current pandemic. With this growing number of cases all over the country, a nurse has an essential role in taking care of patients diagnosed with this pandemic. The working conditions experienced by the nurses gives a warning or negative impact to their mental health status. For the objectives, this study aims to identify the mental health status of nurses during COVID-19 pandemic.
For our theoretical framework, this research is anchored on Cooper and Palmer's work stress model, in which the effects and risk of stressors are evaluated over time with employees, and Roy adaptation model that assesses the patient in physiological mode, self-concept mode, role function mode, and interdependence mode in order to provide optimal treatment. For the methodology, the researchers use descriptive quantitative research design. The study used random sampling method using the Rao-Solf calculator with the recommended size of 67 staff nurses of Metro Bacolod Hospital. The instrument, the researcher used a researcher-made questionnaire. For our statistical tool, Black 1 percentage, Black 2 Likert scale, Black 3 frequency distribution, Black 4 ANOVA, and Black 5 descriptive correlation. This section contains the results, study, and interpretation of the survey of nurses conducted during the COVID-19 pandemic. For the demographic profile, 53.7% are 23 to 30 years old, 32.8% are from 31 to 35 years old, while 9% are 36 to 42 years old, and 4.5% are 51 years old and above. For the years in service, 70.1% has 1 to 5 years of service, while 17.9% has 6 to 10 years of service, 9% has 11 to 15 years of service, and 3% has a 20 and above years of service. For the areas of exposure, the top 5 are 23.9% are from medical wards, 13.4% from private rooms, 11.9% from OPD or outpatient department, 10.4% from isolation room, and 11.9% from emergency room. For the sex, 70.1% are females, while 29.9% are males. Factors that affects the mental health status of the staff nurses are, first, workloads with 79.1%, second, fear of exposure with 74.6%, third, physical fatigue with 67.2%, and also mental fatigue with 67.2%, and lastly, PPE shortage with 58.2%.
For the Table 4, it presents the top 5 coping strategies to promote mental health wellness of staff nurses, which are adequate sleep and rest, which is 85.1%, sufficient PPE, which is 64.2%, leisure time, which is 62.7%, lesser workloads, which is 59.7%, and lastly, doing exercise, which is 47.8%. For the Table 5, it is the significant difference of the mental health wellness of staff nurses when they are grouped according to sex, age, area of exposure, and years in service. The results show that there is no significant difference when the staff nurses are grouped according to age, sex, area of exposure, and years in service. For the conclusion, as a whole, the mental health status of staff nurses when grouped according to age, sex, area of exposure, and years in service is very good. The participants are grouped according to age, sex, area of exposure, and years in service. Majority of the staff nurses are in ages 23 to 30 years old with 1 to 5 years in service. For the area of exposure, majority of the number of staff nurses are in medical ward. The top 5 factors that affects the mental health status of staff nurses are adequate sleep and rest, sufficient PPE, leisure time, lesser workloads, and doing exercise. The top 5 coping mechanisms that affects the mental health status of nurses are adequate sleep and rest, sufficient PPE, leisure time, and lesser workloads. And lastly, the results showed that there is no significant difference in the mental health status of the staff nurses when they are grouped according to age, sex, area of exposure, and years in service.
Lastly, for our recommendation, the researchers to take actions regarding with the factors and coping strategies for the nurses to have an excellent mental health status for the nursing service that they may be able to maintain the very good mental health status result of the staff nurses during COVID-19 pandemic. And lastly, to the future researchers that they may be able to do future study that would accommodate larger scale of staff nurses. Thank you so much for listening. We appreciate your time and patience. Have a great day.